Hello everyone, welcome to my channel again. My name is Morolake. I'm a registered nurse. To my returning subscribers, I welcome you to my channel again and thank you for subscribing to my channel. And if you are viewing my channel for the first time, I also welcome you to my channel as well. And don't forget to subscribe to my channel. Today I'm going to talk about cervical incompetency. It's also known as cervical insufficiency. So don't go away. Let's dive into this topic together. When a woman is being diagnosed of cervical incompetency or cervical insufficiency, what does this terms mean? What does it mean when a woman is said to be having cervical incompetency? This means that the cervix of that woman is shortened more than the normal length, and this can result into painless dilation of the cervix before the woman is 37 weeks of pregnancy, before the baby organs develop, or before the baby is viable to survive outside the uterus environment. It can cause miscarriage, it can cause spontaneous rupture of membranes. How can cervical incompetency be diagnosed? It can be diagnosed through previous history of miscarriage at second trimester or through premature birth before the pregnancy is up to 37 weeks of gestation, or it can also be diagnosed through transvaginal ultrasound. As a woman with this condition, your question that you may likely want to ask me is that, can you be able to carry your baby, can you be able to carry your pregnancy to term with this condition? Yes, there are treatment regimens for this condition. Number one thing is that they are going to advise you on bed rest to rest very well, and there's going to be hormonal therapy to support your pregnancy in order to carry the baby to term, which is injectable. The popular and the common treatment for cervical incompetency is through cervical cerclage, and unabsorbable suture will be used to suture the cervix together. You know, the cervix is like a gate between the uterus and the vagina. So these unabsorbable, undissolvable suture will be used to suture the area together by the obstetric and gynecologist. And this procedure is mainly done at 14 weeks to 17 weeks in order to prevent the cervix from open and give way for the baby or fetus to come out. This is important. The question is that, is it everybody that is fit for this procedure? Some people are not fit for this procedure. Number one thing is that if the cervix is already dilated to like 4 centimeters, you may not be a fit for this procedure. Another thing is that if there is rupture of membrane already, you know, if the membranes, the fluid, had what is actually protecting the baby in the uterus. But when the woman has actually lose a lot of fluid, that there is not enough fluid to actually sustain the pregnancy, you may not be a fit for this procedure. And also there's going to be a follow-up after this procedure. You're going to be follow-up. You are going to be assessing your healthcare facility frequently more than someone that does not have this condition. Another thing is that you have not to compare yourself with any other person, or when you are seeing a woman and they recommended that the woman should have bed rest. You may be thinking that what is wrong with the person. The person did not say maybe she is having any illness to you. Pregnancy journey are different. Even as a woman, as a person, if you have more than one pregnancy, the pregnancy journey may be different from each other. This is very important. Yield to the instruction of your healthcare provider, maintain bed rest, eat adequate and balanced diet. These can actually help you a lot. Another thing is that you may likely want to know if you are being diagnosed of cervical incompetency in one pregnancy. Is it possible for it to reoccur? Yes, actually, it is actually possible for it to occur when there is not changes in the cervical length. There is possibility of this occurring, but put your mind at rest. There is treatment regimen to enable you to carry your baby to term when the baby is ready to survive the outside world.
Lest I forget, there is going to be a period when the suture is going to be removed. By the time the baby is mature enough, viable enough to sustain the outside environment, there is going to be a plan for the removal of the Cerclage. Have come to the end of the video. Thank you for staying with me to the end, and for every expectant mother, pregnant woman that is watching me right now, I wish you a safe delivery, healthy babies to healthy family. Bye for now.